So the next question is how to choose between the different bariatric surgery procedures.
So there are a variety of bariatric surgery procedures that are now offered. Lap bands have effectively fallen out of favor. Most of us are simply removing lap bands and not placing them. There are a few people who are still placing them, but for the most part, your three options are sleeve, gastric bypass, and duodenal switch. It's very interesting because bariatrics is really the only field in medicine where the patients, for the large part, get to dictate their care, okay? Every operation that we do has a certain amount of compromise to the patient, change in lifestyle, change in dietary habits, maybe a change in bowel habits. Every operation has a different benefit to blood pressure, to diabetes, to sleep apnea, to high cholesterol. But because of the compromises that may come with an operation, our patients get to choose which compromises they're willing to accept to have an outcome that they desire. So bariatric surgery is highly studied. It's far more studied than hernia repair or anything else. And so we actually have access to databases, and these databases have 800,000 patients across the country. So I can plug into the system. I have a 37-year-old African-American female with insulin-dependent diabetes and sleep apnea who is pursuing bariatric surgery at her BMI of 45. What will her outcomes be with a sleeve, with a bypass, or a duodenal switch? And I can show that to that patient and help her decide which is right for her. And when it all washes out with, you look at primary operations, about 60% are choosing sleeve, 30% are choosing bypass, and 10% are choosing switch. And that's in my personal practice. If you look at national averages, it's probably 60, 39%, and then 1% are choosing duodenal switch. And so I don't actually choose. My job is to teach my patients about the operations, teach them what to expect from the operations, and to make sure they're not selecting an operation that is bad for them. I'm not going to do a gastric bypass and say someone with a strong smoking history. I'm not going to do a sleeve in someone with a strong reflux history, or maybe inflammation in the esophagus called esophagitis. But as long as they're choosing an operation that medically is acceptable to them, my patients get to choose which operation is right for them.
Okay, perfect. That was very, very clear.